Hello, everyone. This is day 7 of the Dr. Johanne Louis Foundation Healthy Heart Walk Challenge. I am joined today by my colleague, Lori. Say hi, Lori.
Hi, everybody.
Yes, I told you all wherever I am, we're going to stop and we're going to walk for 15 minutes. And if we both pass out, you will understand that we have had one heck of a day.
Yes.
But we said this is important because February is Healthy Heart Month, is Heart Disease Awareness Month. So we're just going to keep doing this, keeping our commitment to you, so that you can keep your commitment to us, so that we can live healthier, okay? So far we've discussed, Lori, we've been discussing that heart disease is the #1 killer of women.
Yeah.
1 in 5 women die of heart disease. So we've been talking about things that we can do to stay healthy. We're going to walk up a little bit. We're going to walk back a little bit. And we just keep moving. It doesn't matter how you move. You just have to keep moving for 15 minutes. Okay, everyone? So we're glad you can join us today. So we talked about different types of heart disease. We talked about coronary artery disease, where plaques build up in your coronary arteries. We talked about different arrhythmias, especially AFib, that can cause blood clots, that can travel to different areas in your body, including causing, exactly, right?
Scary.
To your brain, causing a stroke.
Right.
So, and then we talked about congestive heart failure, where the pump itself is weak, and it can cause a lot of issues. We're going to do some kicks, Lori.
All right.
So,
Like a rocket.
I know, we're rocket, right? I love this. I need more company when I walk. No one will walk with me, but Lori walked with me
I
today.
will walk. Yes. I need
Thank
to move
you.
more. Yes.
Thank you, Lori.
Oh, thank you. This is a great.
Oh my
great
goodness.
cause.
And then Saturday, so today's day 7. So Saturday, I don't know what day that is, but we're going to be doing this in person at 6219 Lancaster Avenue. That's First Haitian Church of God. And then we always just go back to walking because sometimes the heart gets a little bit too high of a rate. So we just go back to walking as long as we keep moving. So we talked about also, Lori, broken heart syndrome, which most people don't know that when someone says, someone broke my heart, it's an actual syndrome.
Oh, wow.
It is. And what happens during that syndrome is that there's like the stressful event that occurs, okay? It causes some hormonal disturbances. And so therefore, these hormones, it's like adrenaline. And so it decreases blood flow to an area of the heart, and then it can damage the heart. So this can be something that happens because of an emotional stressful event, like a breakup.
Okay. Why don't point at me?
Listen, this happened to me.
No. Yeah. A lot of stress can be.
Exactly. You know, just any type of stress. And it can also happen, like, you know, for people who have surgery. So it's very important to keep our stress levels low.
True.
Okay, and we talked again about the impact of heart disease on erectile dysfunction, and just that blood flow that should be going to one of the most important organs. I don't want to say the most important, but to the penis, that it can also impact that, especially for men. Yeah. So we have to take care of our hearts, decrease our stress, make sure we exercise, that we don't smoke, we limit our alcohol intake, all these things we do to take care of our bodies. So there's also something, and you know, since we're exercising, we're just talking, and so it's not really a formal informational session, but I do want to talk about the relationship between mental health and heart disease, because as you know, Lori, when we have clinic, it can be pretty stressful.
Yes.
Yes. And so there are some mental health diseases that correlate with heart disease. And so we know that anxiety just having anxiety in itself causes stress on the body. It can cause an elevation in heart rate. It can cause a lot of different stress hormones to be released throughout the body. And so it can impact the heart and cause a disruption in blood flow to the heart. And we talk about depression. And if you need to slow down, Lori, slow down because we don't want anyone passing out here.
No.
So depression is one that can also impact the heart and have a negative impact. And heart disease in reverse can cause depression and anxiety, right?
Yeah, right.
So both can cause, they're interrelated. So a lot of people who undergo depression, who have depression, have stress in their lives, and it can cause a negative impact on the heart. And some of the medications that we take for depression can also have negative impacts on the heart, okay? So we just really have to make sure that we talk to our healthcare providers. You're taking off those clocks now, aren't you?
Too much noise.
I should probably take these off too. So we talk to our mental health providers to make sure that we deal with a lot of our psychological problems, our mental health. If we have bipolar, ADHD, a lot of our children even.
Yeah.
And I'm sure that there are some studies out there that show that some children with ADHD may have early developments of heart disease. So we really have to make sure that not only with us as women, but with our mates, whether male or women, that we make sure that we have them go see a primary care provider. And I always start with go see your primary care provider, either be your primary care physician or nurse practitioner, and before the cardiologist, because there are certain tests that they can run that can probably, prevent you from going to the cardiologist. So not every symptom that you have heart related, you need to go to a specialist, but the cardiologist is the specialist. And if your primary care provider deems that you need further workup, then they will send you to the cardiologist. But start off with your primary care provider. If you don't have a primary care provider and you want to go straight, if your insurance allows it for you to go straight to the cardiologist, then do so. And we do want to just always summarize and reaffirm that in women, that heart disease, sometimes you have no symptoms if you're having a heart attack. So you have to, right now, I could be having a heart attack right now. Because it's been a long day. So,
see the stress.
See that? And so this is why we say, Lori and I were talking today, and we're like, it really does make a difference, who you're working with.
Yeah.
Because even when you're having a chaotic day, like we had today, just knowing that you have someone that can help you calm it down.
Yes, crack a joke or something.
Crack a joke, Crack a
Yes.
joke, help you relax, and then we zen. Like I was telling my student, I said, you have to know how to zen yourself and just bring it back down and center yourself. We push out the negative energy all the time. We just push it out all the time, and we bring in the positive energy. And as you see, as we bring in positive energy, we're sort of like in prayer mode, and so I pray.
Helps, yeah.
I meditate, yes, and it's not for everyone, and I'm not telling anyone what to do, but for me,
It helps.
to relax my mind. Like last night, I'm an insomniac too, Lori.
Oh boy.
I'm sharing a lot today. But so last night, for me to even get like 2 hours of sleep, I had to put on some meditation music. I had to fall asleep with it. So yes, I'm looking ragged. Y'all stop talking
You look
about me.
fabulous. What are you talking about? Oh my goodness, I gotta try that.
No, I was trying not sleeping. So I say, I try to zen. I try to just relax. Try to take care of myself, because women over 50, you're over 50. I don't want to put your age out there. So we're both over 50.
Yes.
So as you know, women over 50, as we go through these changes, our hormones are just all over the place. And so be careful, honey. We will not be sued, no. So our hormones are all over the place. So it's very important that we take care of ourselves, our bodies. It's important that we stay active.
Yep.
We exercise, 15 minutes a day. Although for the past 2 days, this seems like longer than 15 minutes that we walk. But 15 minutes a day is not too much. And you should really exercise a little bit more than 15 minutes. But, I'm just keeping my commitment to you that I said no matter where I am, no matter what point of the day that I'm in, I am going to see you for 15 minutes a day.
All right.
And so we are here. I'm so happy that Lori got a chance to join me today.
Yes,
Lori, talk to the people.
Hi.
Lori, say
How are
hi.
you? This is actually helping me to
See that?
de-stress. from
De-stress,
a
right?
Chaotic morning, yeah.
I'm telling you, anytime that I'm here during these 29 days, I'm going to come and grab you, Lori,
Yeah.
and we're going to walk for 15 minutes.
Yes.
We're going to do some knee lifts now.
All right.
Because we got to keep it, change it up a little bit, get our hearts pumping the way that it should. Because I can't make it to the gym.
Well, maybe one day this week we can get outside. In the sun
Yeah,
and
we can go
outside.
walk. Maybe we'll do the video while we're walking.
Okay.
Wherever we're gonna take it on our lunch break, because we don't use our job time. We do it on our break, okay?
Yes.
But even if we were to do it on the job time, this is a way, because where we work, and I'm not even gonna say where we work,
Yes.
but where we work, they really think about employee health and trying to make the lives of the employees better. Do you ever catch those Monday and Tuesday at noontime? They have these yoga, imagery, just different types of.
Yeah. I've seen those,
Yeah. It starts. They say it starts at 12, but it normally starts at 12:15. So we just take time out and we de-stress. Like I said, we zen.
Yes.
This is what I do best. I know how to close it all out. Whenever something is irritating me, I just smile through it. Can't happen all the time, especially with them kids.
Oh, I forgot. That's a whole other.
That's a whole other
stress
video.
level.
But we know what we're going through. I think we have our youngest the same age, so they're
Teenage
lovely,
boys.
but they are teenage boys. So
Yeah, they push
woo,
the limits.
especially when you're over 50. That tolerance is
Yeah.
okay.
Very
But
much non-existent. Yeah.
we digress. So we just want you to all take care of your mental health, because your mental health impacts your cardiac health, and your cardiac health can impact your mental health. As we've read, after heart surgery, there's high rate of depression, high rate of anxiety, okay? And some of the population that we serve with PTSD, we really have to encourage them to take care of their heart also. And we've learned that diabetes negatively impacts on heart disease. So we have to keep our blood sugars under control, our hemoglobin A1C under control, our cholesterol under control. Basically, people, overall, try to eat a heart-healthy diet, low-fat, low cholesterol, lots of fruits and vegetables, drink lots of water, limit our sugar intake, and keep moving, exercise, keep those joints. And I like to rotate those joints and lubricate the joints. So we try to do all that.
Bodies in motion.
Bodies in motion,
right?
exactly. Oh, I love her. Oh my goodness. So we are happy that you joined us today, that you were able to walk with us today for 15 minutes. Oh my goodness, it makes my heart so happy.
Yes.
So if you can, join us on Saturday in person at 6219 Lancaster Avenue in Philadelphia, 19151. We're going to do it in person. We're going to do some blood pressure checks, and it's gonna be just a time. It's gonna be a small group, but just a time to get together. And guess what, people? You did it. So proud of you. Yay! Take care.